Appendices A through F in the back of your textbook cover medications that are not identified in other sections of your textbook. For all of these sections, please read the nursing considerations, particularly the implementation and evaluation, because these sections discuss how to administer the medication and how to monitor the patient for effectiveness and for side effects. Let's start with Appendix A, parenteral nutrition. Is used for patients who cannot tolerate oral food and fluids, and it's given as a replacement for the fluids, sugars, electrolytes, and nutrients they are missing by not being able to eat. They are formulated individually and based upon the caloric and nutritional and electrolyte needs of the patient. There are several adverse effects, and they are related to fluid overload, to an electrolyte imbalance, to the fluid shifts that occur because of the osmolality of these fluids, and when considered with the central line placement, because most of these nutrients are delivered through a central line, there are complications with line placement, including puncturing a lung and creating a pneumothorax, the risk of infection, particularly at the site, emboli, and again the metabolic imbalance that may occur with fluid overload or an over or under administration of particular electrolytes. You have several nursing considerations that are found in that nursing considerations section, including the IV bag of TPN needs to be refrigerated. You need to check it to make sure that there are not precipitants into the bag. The 24-hour time limit, including the tubing and the placement of an online filter on that IV tubing. Then the fluid is typically tapered over time, over several days, to avoid fluid and electrolyte imbalance if it's suddenly discontinued. Nothing else can be added to that tubing except for lipids, which can be piggybacked into the TPN. There are many safety measures, and if you think of the word alert as identified on the chart, aseptic technique, label, elevate the head of the bed 30 degrees, having the right patient formula and tubing, and tracing all the lines. Those are the important safety features for administering TPN. In Appendix B, you will find information on topical agents. Topical agents may be given in other routes, but as topicals, they are for surface use only. And with application, you must be careful not to expose the drug to the mucous membranes, to open wounds, to avoid absorption issues. Particularly for you, the nurse, you need to be gloved at any time you're handling a topical solution. That includes a transdermal patch, which is a slow-release version of the drug in the patch form. Topicals are prepared as creams, ointments, or those transdermal patches, and they need to be applied to clean, dry skin. There are several adverse effects, but these are local in the form of irritation, stinging, and burning, unless they are inadvertently absorbed into the system, at which you can have some more toxic effects. Patient education is listed on your chart and is also identified in that section on implementation of these medications. For purposes of testing, there are several examples of topical agents, including the antiseptic chlorhexidine, gluconate, antibiotics, mipiricin or mipiricin calcium, which is brand named Bactroban nasal, which are used for MRSA. The antiviral that we chose was acyclovir, which is administered for patients who have herpes virus. There are some antifungals, clotrimazole and tolnafenate or tenectin, which is used for athlete's foot typically. There are some pedialocides and scabicides, and for arthritis relief, capsaicin has an aspirin component to it and is often used by patients with arthritis for local pain relief to avoid that systemic effects of aspirin and NSAIDs. Burn preparations are listed here. Sulfasalfidine and mafenide are typical burn preparations. They may come in a jar, and so you have to be careful not to contaminate the jar of medication while you're administering it and preparing to administer it. Topical corticosteroids you may be familiar with. Hydrocortisone is used for anti-inflammatory effects. And so those are the most important examples. So for all of these, the absorption, the contraindications and adverse effects and miscellaneous information is true for all of these examples. In the third appendices, Appendices C, you learn about ophthalmic agents. And ophthalmic agents come in three forms. They may be mydriatics, which dilate the pupil for an exam, and I've given an example there of cyclopentolate. Cycloplegic, which paralyze the muscles that control the lens, and that is typically atropine. And then there are drops for glaucoma that include miotics, which constrict the pupil to decrease resistance to that aqueous flow. That example is pilocarpine. And then beta blockers may also be used in drops for glaucoma. And there are also prostaglandins. Latanoprost is a very common one. They are all used to reduce eye pressure. The miotics are used for eye pressure related to glaucoma. For all drops, you should not give the drop if the patient has an allergic reaction to that drop in the past. And for most drugs, in the directions for how to give eye drops, you will find that most eye drops you need to give 5 minutes apart. So if you have a couple of drops you're using for glaucoma, you give one drop, 5 minutes waiting before you give the other drop. And then again, some drugs may be spaced 1 to 2 hours apart because of the way they act. And your physician, the physician and provider will write specific directions for that. Latanoprost is a prostaglandin. It lowers intraocular pressure, and latanoprost does have an adverse effect of causing brown discoloration of the iris of the eye with long-term use. It can also cause eyelashes to grow thicker and longer. With latanoprost, it is applied in the evening, and patients should remember to take their contacts out before use and to leave them out at least 15 minutes after administration because it will discolor the contact lenses. These medicines should be kept in the refrigerator prior to opening them, and then once open, they need to be discarded 6 weeks later. So teaching your patient to be able to label their medication when it's open will be very important. Vitamins are either fat or water soluble, and you learned about those in your nutrition course. I don't have any specific ones listed for us here, but they can be used to treat vitamin deficiencies and can be used in pregnancy to maintain adequate vitamin levels as the fetus grows. Again, allergy to the drug, particularly to any additives or preservatives or colorants, such as red food dye, need to be considered when choosing a vitamin supplement. They may cause GI upset and irritation. Pyridoxine or vitamin B6 interferes with the effectiveness of levodopa and can cause toxicity, and we'll talk about levodopa later in the semester. So just know that some of these these vitamins can cause some side effects. And again, patient education is important because if you're choosing a multivitamin and then you're trying to add one specific vitamin with it, you can create an overdose situation. So patients need to be taught to avoid the OTC or over-the-counter drugs that have the same vitamins in them. And if they're having some GI upset, they can take them with their meals, and that helps decrease that. In the next section, which is labeled Alternative and Complementary Therapies, this is the section that truly talks about herbs. And while you have a laundry list of herbs identified in these charts, I have picked out some that are particularly important for us as we consider other medications during the semester. So if you just know the information on this chart, you will be fine with test questions and with understanding and remembering how they impact other drugs that we will be talking about during the semester and that patients may take. PMS, premenstrual symptoms, rheumatoid arthritis is RA, and black cohosh root are sometimes what people will take them for over the counter, but you need to avoid black cohosh root with hormone replacement therapy or hormonal contraceptives. And also, this herb may decrease blood pressure given with hypertensions or sedatives, so it can decrease the blood pressure abnormally low and cause the patient to have syncope or fainting and can cause falls. Feverfew is often taken by individuals as an over-counter treatment for arthritis or for fever or for migraines. The problem is if the patient also takes an anticoagulant such as heparin, warfarin, enoxaparin, then it can increase their bleeding capacity. So they may have some bleeding that you would not anticipate with. Garlic can be used by some patients for colds and as a diuretic. And again, it increases bleeding with coagulants and needs to be used very cautiously as it will impact the blood glucose levels of when combined with anti-diabetic medications. Ginkgo may be used by individuals who want to improve their cognitive function, such as people who are trying to avoid or to treat early Alzheimer's disease. It increases the blood flow to the brain and apparently, and can also increase bleeding if given with anticoagulants. There are many drug-drug interactions, so ginkgo needs to be used by patients very cautiously. Ginseng is taken by individuals who may feel depressed and need to elevate their mood, or it can also be used to decrease cholesterol levels. Again, it can increase bleeding with anticoagulants and has many drug-drug interactions. And finally, St. John's wort is often taken by individuals for depression, for premenstrual syndrome, PMS is premenstrual syndrome, and to treat viruses. The problem with St. John's wort includes photosensitivity, thrombocytopenia. Again, it has many drug interactions, and it interacts with foods high in tyramine, which we will find later becomes very important when you're taking medications that also impact tyramine levels. And we'll learn about that later in the semester. The last section, Appendices F, talks about diagnostic agents. And what I want you to get from this section is the difference between in vitro agents, which are outside the body to measure the presence of elements, so proteins, blood glucose, bacteria. They're used to diagnose conditions, as well as in vivo, which introduces the drug into the body to evaluate specific physiological functions such as cardiac output. So they may give you a drug and then do a scan to see how that flows through the cardiac system, or how the intestines absorb that particular drug. So in vitro is outside the body, in vivo is something we introduce into the body. Any side effects may last for a very short period of time and usually can be tolerated by the patient, particularly if you forewarn the patient what to expect. So if the patient is undergoing a CT with contrast dye, they may feel flushing and feelings of warmth, which goes away in a few seconds. But if you're not prepared for that, it can be quite distressing to the patient. Comfort measures to help them tolerate the drug effects and monitoring for their response is important. And that's all we need to get from that section. So this short introduction to Appendices A through F, if you learn the particular drugs under the topical agents and you learn the information on the chart and review how to administer the medications in the nursing consideration section, you will have what you need for this section.